Hello and welcome to Stoicism, Philosophy as a Way of Life. My name is Donald Robertson and today's guest is Windy Dryden. Windy is Emeritus Professor of Psychotherapeutic Studies at Goldsmiths in the University of London. He's been working in the field of psychotherapy since 1975 and was one of the first people in Britain to be trained in cognitive behavioral therapy, or CBT. He learned from pioneers such as Albert Ellis, Aaron T. Beck, and Arnold Lazarus, among others. He's a very influential figure in the field himself, best known as the UK's leading expert on Rational-Emotive Behavior Therapy, or REBT. In a career spanning almost half a century, he's worked with thousands of clients, trained countless students, and written or edited 285 books and counting on psychotherapy. One of the most widely read, by the way, is his REBT-based self-help book, 10 Steps to Positive Living, and I recently read his Overcoming Anger. Initially came out in 1993, but it's been revised since, which I hope we can talk a little bit about later. So, Windy, hello, welcome. How are you? I'm looking forward to our chat.
Very well, Donald, and thank you very much for inviting me.
So, I want to focus on questions that really tap into your vast experience and that might be of some practical benefit to those listeners out there. But I think we have to preface that with a little bit of background. And I think a good way to raise that, to cover that, would be to ask you how psychotherapy has changed since you first entered the field in the 1970s. What do you think is different since you first became a psychotherapist?
Well, I think you've got probably much more emphasis on things like integration and pluralism.
Hmm.
The old term eclecticism seems to have gone out of fashion. So I
Hmm.
think that's changed a bit. There's the CBT that I was originally, trained in. Seems to be quite different from CBT at the moment.
Mm.
I think um, the the old second wave uh, emphases on let's see if we can help people to change their cognitions and attitudes seems to have given away to the more third wave
Mm.
emphasis on acceptance and mindfulness and it's almost like we're saying either it's too difficult to help people to change their ideas
Mm.
or people can get easily caught up in it, so let's see if we can offer them a
Right.
different perspective. And I do have certain things to say about that if you want to kind of talk about that a little bit later, but I
Yeah,
think
we can come back to
certainly in CBT we had I mean, I was in Philadelphia in 1981. I spent 6 months doing an extended training with Aaron Beth and his people. And although that was sort of 2 years after their cognitive therapy of depression came
it.
out, and although that was seen to be a manual, it's kind of a lot less prescriptive than some of the
Hmm.
approaches to CBT now.
Right.
Um, so I
Yeah.
think that there's been quite a lot of and certain approaches like I mean REBT, it used to be much more influential back
Hmm.
in when I first trained than it is now. I mean, to be to be deemed to be Britain's leading REBT therapist in the UK is not exactly. There's about four of us. No,
Right.
I'm joking, but it does seem to have lost a lot of popularity. Again, because it's seen to be part of the sort of the second wave approaches.
Yeah. The old guard.
And it's not segue. I mean, I think that if you look at therapies as well as what we do, but how they're marketed, I think Beck and his people have done a great job of somehow
Uh,
segueing from cognitive therapy to cognitive behavior therapy.
hmm.
So the term cognitive therapy tends not to be used with any degree of frequency these days, I think.
Yeah. Yeah. And I mean, there was originally REBT was controversial in some people's eyes because, it was emerging at a time when psychodynamic and humanistic therapies were dominant. So I kind of feel, up until a few decades ago, there was more pushback against the cognitive behavioral approach. And then it gradually became like gain. It took CBT a little while to gain mainstream acceptance. Would that be fair to say?
I think so. Yes. I mean, I think that. Uh, I mean, I do, particularly in Britain, give a lot of credit to people like David Clark and Paul Salkowskis, who are
Mm,
the kind of forefront of actually really kind of bringing, cognitive behavior therapy into Britain and into the National Health Service. So I think they've done a splendid job of actually kind of sort of making it almost sort of like the central plank of psychotherapeutic interventions.
yeah,
Um, Now, I think that's fallen away to some degree, and as I say, because of the impact of the more of the third wave approaches, and I think the kind of
yeah,
the more openness to psychoanalytic approaches to being more empirically supported, and
mm,
um, the uh, the recognition that, for example, counselling for depression, which stems largely from a person-centered approach, that it seems to be of value as well, and all the interpersonal approaches as well. So I think that we've got. I mean, we've come back to the idea that there's still
yeah,
quite a lot of different approaches, but they're different from where I was. Like, so you've got approaches like Adlerian therapy, which is
yeah.
now virtually disappeared. Sorry if I'm offending
Sorry,
anybody.
Adler. Yeah,
Transactional analysis, which is there, but again,
yeah.
not as popular as it was. Gestalt therapy again is there, but not as popular uh, as it was. So you've got a bit of a sort of a shaking up of the different approaches coming to the fore, I think.
You must feel, and maybe I'm putting words in your mouth here, but do you think some things come around in cycles? Like, you kind of hinted at that already, a little bit. I think. I mean, that you mentioned Gestalt therapy. There's bits of Gestalt techniques that seem to me just to be recycled in acceptance and commitment therapy and some of the third wave approaches. We get the new thing.
Well,
Sometimes we
I
get
mean,
old techniques under different names.
yeah. I mean, some wise person once says that one doesn't make a career for oneself saying that I've
Mm,
done what he or she has done.
mm,
You make a name for yourself by coming up with something novel, which I mean, it's an interesting book that I'm not quite precisely clear about the title. As um, It was about how Albert Ellis's ideas can be found in um, a number of different current approaches, but without necessarily
yeah.
doing what ideally people should do, which is to say, look, let's give credit to him. So you've got the sort of situation now, Donald. One of the most influential introductions to cognitive behavior therapy, I think it's edited by Helen Kennelly, doesn't mention Ellis or REBT.
Yeah. Yeah, I know. I know exactly what you're talking about. It's kind of crazy, and I don't like the NHS. Obviously, shapes the culture of CBT to a large extent in the UK, and REBT doesn't feature like in the NHS worldview of CBT very much. But do you
No, in fact,
know one?
the BABCP as sort of there's the argument, is REBT a cognitive behavioral approach or not?
Yeah, that which like seems odd. But I was going to say, like, one of the things that I like most about Albert Ellis is that out of all of the psychotherapists that I've read, he's probably the one that most frequently mentions his predecessors and his inspiration and where he got ideas from. Like Ellis is always referencing. He says, "Oh, like you get this technique in this therapist," and
Yeah,
like I got some inspiration from the Stoics and from Buddhism and things like that.
yeah,
Whereas other authors, it's like they act as if they'd never read any books on psychotherapy before, and this is all original stuff that they're coming up with.
yeah. Yeah, I certainly would agree with that, Donald.
But he had strangely a kind of intellectual humility that I think is quite admirable. But there's one guy, at least it stands out for me, that Ellis doesn't mention, although I believe that Ellis claimed that he hadn't read his works but found out about them later, and that's Paul Dubois. who was a big deal back in the day and then was almost completely forgotten about. He had a kind of
Yes.
rational approach to psychotherapy at the beginning of the 20th century.
I think Ellis does mention
He
Paul
mentions him,
Newbrass
yeah.
somewhere, but not, giving him as much, credit. And maybe Donald, one of your future projects might be the rehabilitation of Paul Dubois.
Bring him back. Bring
Bring
back
him
bring
back.
back rational psychotherapy from the Edwardian era. Let's do it. So we should probably say a little bit about what is REBT because we're going to have some listeners that aren't very familiar with it, and they should be familiar with it. So, in a nutshell, and I'm sure you've done this many times before, how would you explain what? First of all, let's say where does REBT come from? Like, how did it originate? We've mentioned Albert Ellis in passing. He's the he's the
Sure,
originator.
sure. I think I think there are certain roots into REBT, and as you said that Ellis was good at crediting people who had influenced him, and some of the people who have influenced him have been Bertrand Russell,
Mm,
of course, the Stoics, and I always like to say if we take, I've seen various versions of this, but let's take people um, are disturbed not by things but by their views of things. And
mm,
so Ellis would, well, I would say, because I've sort of did a bit of a makeover of some of the language of REBT, which I've not exactly been happy with
yeah.
over the years. But people disturb themselves about things
Hmm.
because of the rigid and extreme attitudes that they
Mm,
hold towards things. And the other thing is, and if they were to hold a set of flexible and non extreme attitudes towards the same things, that they would respond to these things with greater a degree of healthy behavioral responses, emotional responses, and cognitive responses. So I think at the root of REBT, I would still say is it.
yeah.
I would say that REBT was basically an attitudinal
Hmm.
approach to an understanding of human disturbance and health and the implications that that has for therapy.
Could you give a common example of a rigid demand?
Yes, I think a common example might be that let's take an anger example that people absolutely must follow good behavior like queuing up for a bus,
Hmm.
you know. And so you start off with a very healthy preference. And the thing I like about REBT, it's really saying, look, our preferences are just fine. I mean, it's I would like people to do the right thing and to queue is fine. And then you've got a choice between saying, and therefore they have to, or sadly, they don't have to. And if you
Mm,
go they have to, you get one type of anger. And if you go the other way, you get a different type of anger. And so I think one of the things that I like about REBT, it does distinguish between healthy and unhealthy negative emotions, as it calls it. It's interesting,
yeah.
Donald, if you look at or read people, and people have got different views about what emotions are. Some people say that all
Mm,
emotions are good, um, and it's what we do with them that is the problem. And REBT is saying, well, actually, if you set yourself up a certain way, you're going to get into trouble if you hold these rigid and extreme attitudes.
yeah. Well,
Um,
well, we were talking about the past. Something similar used to be called the tyranny of the shoulds.
yes, and that is Karen Horney. We should give a
Yeah.
shout out for Karen.
Big shout out for Karen Horney. So these should statements are actually sometimes quite prominent in anger, like maybe particularly explicit in anger. Particularly, people should not speak to me like that. I
Well,
should not do this or that.
you see, there are about nine different meanings of the word should.
Yeah.
in the English language, and therefore, if when I'm training therapists in REBT, I'm just saying, look,
Uh-huh.
sure, you can use the word should, but kind of make sure that we distinguish between, preferably should and,
Yeah.
absolutely should. It's the rigid version of the should that gets people into trouble, not
It
the
re-
idea that it's a good idea or I recommend it and things like that.
so it's more about the rigidity than about the semantics per
Yeah.
se. And
Oh, yeah.
Wendy, if to talk about a completely different type of philosopher, that reminds me a little bit of a distinction that we get every philosophy undergraduate learns about from Immanuel Kant between a conditional imperative and a categorical imperative. So Kant said the categorical imperative is you should do this or you should do that. It's unconditional, it's absolute. And a
Mm.
conditional imperative is if you want to achieve such and such, then you should
Yeah.
do
Yeah.
this, do
That's
that.
right. That's right. And I think that certainly, I think that Ellis did um, give credit to Kant on that point, because it is, difference between, as you say, conditional should and an absolute should. Yeah, quite.
So this is the core of REBT, and it's a pretty solid foundation. Like REBT, I think has stood the test of time in part. Like it's been around for as long as it has, in part because it's a pretty plausible way of approaching a lot of emotional and behavioral problems. But I wonder, could you say a little bit more about how you perceive the difference between REBT and other types of CBT?
Yeah, well, I think that I mean, um, interesting you asked that question because I was years ago. I think after Ellis passed away, I think some of us were saying, well, look, we need to kind of really come up with some sort of statement about,
Right,
what are the unique features of our EBT. And so I kind of gave that some thought and started an article, which actually turned into a book, which turned into a series. And and it's about I call it the CBT Distinctive Feature Series,
right,
which
yeah, yeah.
and so each book in that series lists the 30 different diff, different distinctive features, half theoretical, half practical. And so I think that I mean I think certainly the kind of uh, the idea that we're looking at really the difference between rigid and flexible ideas, attitudes. I think is that's probably the core for me of the approach. I think REBT's viewpoint about the self and the implications for self-esteem is fairly unique still.
Yeah,
I think the
yes.
difference between unhealthy and healthy and negative emotions
Mm.
is again fairly unique and distinctive towards REBT. Um, so I think those are the kind of some of the ideas which I think are really core to this particular sort of approach.
One of the things I just want to ask you, it comes into my mind as we're speaking, it feels to me, I think when you, like, if you've been studying any subject for a long time, sometimes you become more interested in what's really basic about it and
Yeah,
foundational to it. Like I see martial art, if you speak to a karate expert, and you say, like, what's the most important thing? He might say it's the way you stand or the way you breathe or something like that. And the ABC model is the kind of core, in a sense, of REBT. But in a sense, I wonder if one of the main revelations that CBT in general, and maybe particularly REBT, has for people is that we have a folk psychology um, in our society with a very simplistic understanding of emotion. So many people think of emotion as just like a kind of blob of energy or something that builds up inside them. Sometimes people call this the hydraulic model of emotion.
yeah,
And the idea that it's not just how you feel, but it's also how you think, that emotions might be cognitive at some level, I think is a game changer. Like it's a revelation. And that insight alone, I think, is, many people would benefit from just understanding that there's cognition going on in their emotions.
yeah. I mean, I think one of the things that I really uh, kind of like doing it. If you look at the ABC, where
Hmm.
I would say A stands for an adversity rather than an activating event. That's one of the things that something which we perceive to be negative has happened, whether it has or not. That's not the point. But we kind of see some kind of adversity, and we kind of appraise that with either a rigid and non-extreme way of using our attitude, or a flexible. Now, those have an impact on not only the way we feel, but also our action tendencies, the way we feel like acting, and also subsequent cognitions. So one of my favorite questions for my master's course, I used to run a master's course in REBT, was this, Donald. Uh, Cognitions are ubiquitous in the ABC framework of REBT. Now, interestingly enough, they
Right.
wouldn't let me ask that question. You know why?
Why?
Because they thought that master's level students would not understand what the word ubiquitous meant. So,
Really?
really, yeah.
Jeez, man. You have to have a good grasp of language in some ways to be a therapist, because some of your clients are going to be
Yeah. So the
articulate.
idea that the adversities are cognitive because they're inferential, we kind of make sense
Uh-huh.
of it. The
Yes.
obviously our attitudes are at B
Hmm.
are cognitive, and also
Right.
the cognitive consequences, because this kind of way
Yeah.
of looking at it is not only they're going to be emotional consequences of holding attitudes, behavioral consequences of holding attitudes, but also cognitive or thinking consequences. And that's why, when people say nobody will like me, right? I
Uh-huh.
see that as a cognitive consequence of a prior
Right.
rigid and extreme attitude.
Uh-huh.
Um,
And also regarding the adversity or the activating event, there's a whole insight there for people, which is, you could be mistaken, right? So
yes.
you might believe that somebody's been trash talking you, right? Because you've heard rumors to that effect, and that might really upset you. But it could turn out that you're just wrong, you know. It might be a lie, you're mistaken about the supposed event that you're responding to. Now, but REBT focuses on challenging the response to that, or
Well,
the
we say
irrational
let's.
belief.
Well, we one of the things that I'm particularly interested in is I think that, and I think this is relevant to any therapeutic approach, is that you've got a body of knowledge, which in fact you're really saying these are some of the ideas that you might find helpful to clients. Now, clients are coming, with their own ideas about what's going to be helpful, for them. And I think the idea is not the idea is that we're going to create clients in our own image, but the idea is that there's a therapeutic alliance here as well at play. And I think that one of the things that I think REBT therapists kind of neglected over the years was that particular idea of an alliance, that
Mm,
you really are in alliance with somebody, and yes, this might be yeah, makes sense, but if a client's not going to buy it, I mean, I
mm,
remember one of the things that I used to do when I used to go over to America, when the RABT Institute was on the Upper East Side, in a grand building, which unfortunately they had to sell. But I used to kind of sit in on Ellis's groups, um, which was a great, I mean, imagine, being able to sit in and see, some of the greats do therapy live. Anyway, so he was working with this woman, and he's basically was saying, well, unless you accept that Hitler was a fallible human being, you'll be sick for the rest of your life. Well,
uh-huh.
okay, that's an interesting viewpoint. Anyway,
Be quite
2 years
forceful. Yeah.
2 years later, I
Uh-huh.
go back to the same group, and she still hasn't accepted it. So, at what point do you say, look, this client is not going to accept this idea, right?
Yeah.
Or do you kind of keep plugging away at it? So I think that one of the reasons I think
Interesting.
REBT has had a bad name is because it does, if not practiced with a more than a nod to the therapeutic alliance, you can get into that
Mm.
sense that you're arguing with people. And one of the reasons that REBT is no longer
Got you.
regarded as a CBT approach is that because CBT in Britain is now saying, look, the the collaborative empiricism, the Socratic nature of this relationship is a defining feature of CBT,
Mm.
which is strange because it's basically saying that we can say what is and what is not a particular therapy by the style of the therapy, which is a bit
Mm.
strange, I would have thought.
Yeah, yeah. I mean, also, what you're advocating, I guess, as well, is a slightly more flexible understanding of therapy, which ironically, like, it's almost like applying REBT itself. The way you just portrayed Ellis, it sounds like he's being a little bit rigid,
Well, he
and
can be,
imposing a.
but yes, well, he can be. But I think the other thing is that if you read accounts of Ellis
Mhm.
um, from his clients, um, one of the things that come across time and time again is how accepting he is
Yeah.
of the person. Now, I once um, came across an Indian REBT therapist who had published, in fact, he had two thick volumes of correspondence with Ellis,
Oh, wow.
and I was reading these things and I'm saying, I would not have the patience for this.
Uh-huh.
But Ellis, really very, is very good at
Yeah.
correspondence.
Right.
And really being accepting and really patient. And I
Mm.
think that came across, to a lot of
Yeah.
his clients. And one of the
Yeah.
things that he was a bit concerned about is, and in fact, it's an interesting interview I did with him in a book that I published in 1985 called Therapist Dilemmas, and he talked about the dilemmas of being warm with clients. And I think he was a bit concerned that warmth meant that people would, become actually more um,
Mm.
needing of approval, and therefore you have to be a little bit careful about
Yeah.
that.
But Ellis wasn't everyone's cup of tea, but he was one of the great therapists. So here's a bit of trivia about him. Like, I suspect Ellis possibly saw more clients than any other famous, or certainly most other famous therapists. Like, he must have seen tens of thousands of clients
Yeah,
over the
well,
course of his career.
I'll let you into a little secret. um, when I went over to 19 in the Center for Cognitive Therapy in
Hmm.
1981, my new wife, we just got married on the Sunday, and we actually took the plane to Philadelphia on the Monday, and this was an early sign of what married life was going to be like with me. Anyway, she got a job at the Center for Cognitive Therapy
Right.
in Philadelphia, and uh, people, as you imagine, would ring up and say, "I want to make an appointment to see Dr. Beck," and so the
Hmm.
line was, "Dr. Beck doesn't see patients, but we can."
Hmm.
So actually, my argument was that probably Aaron Beck was not a very experienced cognitive therapist because he didn't see that many patients, whereas Ellis, as you're saying, I mean, he's probably,
Sounds about right.
um, had tremendous, experience. And one of the things he used to do, Donald, which
Yeah.
is that he used to make tapes. In the old days, it was reel to reel tapes, but
Hmm.
in modern technology, it was cassette tapes. With the client's permission, he would put it at the end of the day in a shoebox, which he put in the fellows room,
Hmm.
the training fellows, and you could actually go in and listen to Albert
Yeah.
Ellis doing therapy. And one of the things that I discovered, and probably one of the early sort of sort of influences on my later interest in single session therapy is that you could see Ellis for half an hour or you could see Ellis for an hour. And
Hmm.
I'd listen to a number of half-hour sessions for Ellis and hour sessions. And I would say always go and see Ellis for half an hour because
Right.
he's going to do the same. He's going to be a lot more focused,
Interesting.
you see, you know.
That's
So
amazing.
yeah,
Interesting. And the funny thing here, this is a bit of trivia, but we've been talking about the history of the subject a little bit. In some ways, Ellis, in that regard, is the complete opposite of Sigmund Freud. So Sigmund Freud wrote, was it 12 volumes or something of his collected works? But he says very little in all of those books about what he actually said and did with clients.
yeah.
Room. He psychoanalyzes like Moses and Dostoevsky and stuff, but he doesn't really say that much about the actual practice of therapy. Freud, in the course of his entire career, which was he didn't start until he was in his mid 40s or something like that. I estimate Freud maybe only saw somewhere between like 50 and 100 patients because he saw most of them for 2 years, 3 years, 4 years, and he used to see them for 5 or 6 sessions a week. So he couldn't have seen very many. And of
Mm.
the clients he saw, probably most of them, or maybe at least half of them, were in training analysis with him.
One of the books that I'm currently got a contract for to be working on is it's called The Origins of Single Session Therapy, Freud's single sessions. There are three examples
That's
of where
right.
he did
Yeah.
single sessions. One was with Katerina um,
Uh-huh.
in the Alps, where she
Right.
kind of
Yes.
says, "I understand you're a doctor. Can you help me?" One was with Mahler, Gustav Mahler, who kind of made and cancelled an appointment on about three occasions, and then
Hmm.
Freud basically said, "Look, if you're not coming, that's it. You know, last chance." So he actually had a 4 hour session, single session, walking in Leiden in Holland. And there's a one case. I don't know if you've heard of this case. It's called the woman's called Margareta Lutz, and that case is really interesting because it's the only account that we've got of her of him doing a single session from the patient's point of view.
Hmm.
And somebody tracked her down 75 years after she had
Wow.
the session with Freud, and she still can have a vivid memory. And
Wow.
so there was a particular journal issue which kind of based on the interview that they had with her and the sort of number of psychoanalysts kind of making a commentary on that. So I'm going to be doing a sort of an analysis of those three single sessions and see what happens as a result of that. So yeah, he
Yeah.
may have
So even
uh,
Freud sometimes did
yeah,
single
but you
session
see
of
again,
yeah.
if but he never really brought back the insights uh, from that to his everyday, as you say, long term work.
Well, that's our segue into what is what you currently refer to as your single session therapy approach. Like, let's
Yeah,
get
well,
into that.
I mean, I think that yeah, there are examples of single session therapy, dotted around the history
Yeah.
of psychotherapy. But I think that for me, the kind of the a landmark of the development of it was from an Israeli psychologist called Moshe Talmon. Now, Moshe Talmon was an Israeli psychologist who had a long-term private practice, and for reasons which I don't know about, he decided to come to America and did got a job at the Kaiser Permanente clinic in Northern California, and he was something specializing in children and family work. But he did an audit of his work and found after a while that in 200 cases had come once when they were expected to come more. And so he was curious about this and was talking to his colleagues and said, you know, have you had this? He said, oh yeah, we have this all the time. Our 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 clients are not very psychologically minded. This is what we have to put up with. And he wasn't, you know, convinced by that. So he actually rang these 200 cases and found out that between 70 and 80% were quite happy with the one session that they had and didn't
Right.
need any more. And so that kind of gave impetus and to work that he did and Robert Rosenbaum and Michael Hoyt. So for me, and I think it kind of snowballed from there, and it's
Right.
a beginning to be, I mean, I've spent the last 10 years doing training and writing in this particular area. But the idea, I define single session therapy as a purposeful endeavor, um, uh, which is based on an informed consent. Otherwise, a client needs to understand what they're, you know, consenting to, and the therapist needs to agree that, yeah, they're going to offer this. To, to see if we can help the client to take away from the session what they've come for,
Mhm.
on the understanding that further help is
Yeah.
available to them later on. So it's not one session only. People say, tell me about your one and done, one and dusted therapy and things like that. Well, it's not that. But if you look at the
Yeah.
statistics in agencies, the modal number of sessions that clients have is one. You know,
Yeah.
and yet people are trained to kind of think
Yeah.
of therapy, understandably, as something which is going to last over time, sometimes over a considerable amount of time,
Uh-huh.
others over a sort of shorter amount of time, but certainly not just one session,
Yeah. So they are allowed to come back, like,
if they
what
want to,
if they
right?
want to, right? But
But
they
you
don't have
see, a lot of people, as it's discovered, normally the idea is that you offer people a block of six. Now, I always say, why six? Why not five? Why not seven? Nobody can answer that question. But for quite a lot of people, they don't want to come
yeah.
for 6 sessions. It's too much for them.
Yeah. Yeah. So what type of clients do you think, is there like a particular type of client or particular type of presenting problem that's most suited to the single session approach, do you think?
Well, I think that I think we know a lot about um, single session therapy from what
Hmm.
used to be called walk-in clinics. Now we it used to be called
Hmm.
walk-in clinics. Now we call them open access enter now clinics because we don't want to be off-putting to people who can't walk. So we call them open access enter now services. And people who come to those services can, they can come with a variety of different issues. Some just want to, to get things off their chest. A lot, do have a problem that they would like to kind of walk away with some kind of solution which they can implement. Sometimes, they just want to kind of, get a greater understanding. So you've got a multitude of things that clients want, and I think you do need to be, responsive to that. So, but I would say probably
Right.
most of the time clients are coming with a specific issue that they would like to have some help with, and they don't want to kind of, spend a lot of time in therapy.
So is there particular information? So I think one of the things that I saw you mention somewhere was that in many forms, perhaps most forms of psychotherapy traditionally, there's a lot of information gathering takes
Yeah,
place at the beginning. It could
yeah.
be sometimes in the NHS it might be multiple sessions of assessment and diagnosis. And so in the single session approach, you have presumably have to be a lot more focused on gathering specific information. What's the information that you need to get from the client in order to work with them in that time frame?
What you need to get is what they think you need to have.
Right.
So, one of my favorite questions is, what do you think I need to know about you that if
Yeah.
I didn't know, I wouldn't be able to help you today? Right?
Yeah.
So we don't look, I'm not knocking a person assessment. I'm not knocking case history taking. I'm not knocking case formulation work, but that's not gonna help you too much doing single session work. This is more like a traditional way of working. And I think the core of the single session approach, Donald, is the mindset that
Mhm.
clinicians and to some extent clients have. Um, and so one of the things that Talman talks about is that when they started to do what they call planned single session therapy, because the 200 clients that he had were actually unplanned. They he
Mhm.
thought that they were coming and
Right.
they agreed to come, and then they only came once. It was unplanned. Um, we call these things dropouts, which I don't like the term dropouts. So the idea is that you've got this sort of planned,
Uh,
you've got this planned approach, and uh, you know um, let's see where we go. Is it basically?
Now, I'm just wondering, like, I guess it would depend on the context and the way the clinic operates and stuff like that. But in single session work, as you envisage it, is the preparatory work that the client
Yes.
does. That'd be one way of cutting down the time
Right.
that you need in the
Well,
session.
okay. So I just remember what I was going to say. The group in this planned single session therapy, they started off by saying, "Look, we've got this new way of working. This is what it is. Would you like to kind of, to take advantage of it?" And the one group that really didn't want to take advantage of that were therapists as clients. Therapists as
Right.
clients didn't want singer, and so
Yeah.
when I first started training people in single session therapy, you
Uh-huh.
get people like this, really kind of folding their arms and saying, "We don't want to be here." What's all this
Uh-huh.
about? But I think people are a lot more open about it now. After 10 years,
Uh-huh.
luckily. So
Yeah.
so yeah. So I mean, the way I think of it is this: a session, Donald, from a single session therapy point of view, has three components. One is the preparation,
Mm-hmm.
and you're right. We encourage clients to think about what they want to talk
Mm-hmm.
about in advance. So we often encourage them to fill out a pre-session form,
Yeah.
which helps them to clarify. And if they want to share it with us, then it helps us to be clued into what their thinking is. Then there's the conversation that they have, right? And then there is an implementation phase
Mm.
after the conversation, where the client goes away, puts
Yeah.
into practice, thinks about what they've learned, puts into practice, and then at that point makes a decision if they need another session or not.
That's what I was going to ask you about is like the homework, or as you call it, the implementation stage.
Yeah.
Like, how do you assign homework if you're not planning to see them again, but they keep in touch via email or whatever, and you,
No,
you
not
follow up on?
necessarily. Well, first of all, we don't think in terms of homework because
Right.
homework is
That's a
something
terrible word,
specific.
isn't it? Yeah.
Well, I mean, it's not so much a terrible word. It's more like a specific task.
Do you not think it sounds a little bit
Whereas,
patronizing? It's something. It reminds me of being a schoolboy or something
yeah,
when
yeah,
people talk about.
yeah.
Oh, yeah. I always try
We're
to think there
talking
must be a
about,
better word.
I think I think even in more traditional CBT now, they talk about takeaways. What are you going to take
All right.
away and put into practice? And so we're talking about something a bit more broader that then clients might think about how they can start off that particular, process. So I think the idea is that because it's often strengths based and you're really working, in terms of helping people to say that actually they may have actually solved the problem before, but in a different context,
Mm.
and helping them to see that can actually help them to go forward now. So there's a lot of things that we tend to do in single session therapy, which I would like to see all therapies do. Let's kind of
Yeah. I
see the client as resourceful. Yes,
was
they've
going to
got
ask you that.
problems. Sorry.
Is there anything you've learned from doing single session therapy that changes your approach to ongoing therapy?
Yes, I am much more open to saying to clients, you come and book when you want to see me next,
Mm. Okay.
as
Right.
opposed to the more traditional, let's book you in, and so there's none of this, same time next week over the next, unless
Hmm.
the client wants that. If the client,
Yeah.
and so the client might say, well, actually, I would like to book a number of sessions to see you. And I say, fine. Okay, let's take it on a, you may not need all of those things, but if it's useful for you to have them, that's fine. So, and it's probably, in a way, it's not a great way of running a private practice
Hmm.
in terms of earning a living, but I think it's a real, it really takes
Oh,
takes seriously the idea of being client led.
yeah. It's a very interesting question. I really believe that, in order to develop psychotherapy, we need to experiment with different formats. Like, it's partly just sort of tradition and convenience that leads people to do things in the 50-minute sessions once a week or whatever. But what you said is spot on. There are economic interests that influence the way that psychotherapists work. I mean, especially I remember seeing a psychoanalyst when I was first training, and he told me quite candidly, if he loses one client because he sees them 3 or 4 times a week, that's a substantial drop in income
Yeah,
for
yeah,
him. Like, so he had a vested interest in his clients not leaving therapy,
that's right.
right?
Yeah, and there was
Which is,
an interesting cover. I had it, so I don't have it here, but I've got it, I think, in my office. That the idea, it was a New Yorker cover. It was called "The Prisoners of Psychotherapy," and they had this
yeah,
client that was sort of, bound with rope
chained
so
to
that
the
they
chaise
couldn't.
longue.
Yeah,
Yeah. Now, I wanted to kind of conclude by asking you a little bit about anger.
right.
It's just because it's one of my favorite subjects, right? And it's big and stuff. I wanted to mention, I think maybe I read your book, and I vaguely remember you saying something similar yourself. But one of the reasons I'm interested in it, I was really angry when I was a young guy. When I was a teenager, I distinctly remember thinking, I'm
Yeah,
just angry all the time. And it's almost in some ways a benefit of having a very pronounced problem, is it motivates you to do something about it. Like many people, I reached the point where I just thought, I'm sick of this. I need to do something about it. It's too
yeah,
much. And so in my 20s, gradually, like just through really reflecting on it, I think, and questioning what was going on. And then by reading the Stoics, and reading other philosophers, I changed. And so now I think I got rid of most of that anger successfully over the years. But it made me want to help other people that have got similar issues. And I
right.
see a lot of anger. We see, we're surrounded by anger on the internet these days,
Oh yeah.
and it's something that people come to me a lot and tell me they see as a rising social problem, particularly with young men, is the way that journalists usually
But interestingly
phrase it.
enough, and I think Ray Giuseppe, who you probably know about, who's got a
Yeah,
special interest in anger. He makes a telling point that clients come to therapy for help with anxiety
yeah,
and depression, but they come to therapy for supervision about anger. How can I change the other person?
yeah,
So I mean,
yeah.
it's very difficult to, I think, unless you spend some time really encouraging people to take responsibility
Hmm.
for making themselves angry,
Hmm.
then you really are, walking uphill in treacle when you're working with people.
It's also it's a relatively neglected problem. I mean, I read a book recently, um, where I think it was Ray Giuseppe had written the introduction or the foreword, and he was saying he searched for the how much literature he could find on the subject of anger and psychotherapy, and found that it was pretty negligible compared to the amount of literature on anxiety and depression.
I
Because,
think
like you
it,
say, angry people think everyone else needs to go to therapy
right, yeah.
often,
I think you find a lot of it in the forensic psychiatry
right?
literature,
Yes.
so, if you've sort of, killed somebody, or if you,
Mhm.
and so I think there's a lot of literature in that. But I mean, you're right. This idea of it's we tend to be, quite angry, and I think that, the more frustration there is in society, the more likelihood there's going to be anger.
Mhm.
Um, but
Now, there's a kind
yeah,
of
I mean,
philosophical question that emerges in it. I think you take a particular stance on it in your book. I was going to mention, like, I think in some ways REBT is of interest to me because it's more philosophical in a
yeah,
sense than
yeah,
most other forms of psychotherapy.
yeah,
Um, but so in ancient philosophy, there was a debate with two sides in it, but between the Stoics on the one hand, who thought all anger is unhealthy, and traditionally the Aristotelians on the other side, who thought some anger could be healthy if it's moderate and justified. And that, it was an interesting debate, right?
yeah.
I think there's valid points kind of in both sides, but I think the majority of people perceive anger as being healthy in moderation. But you adopt the view that there's an REBT distinction that can be made between healthy and unhealthy anger. So what I'm really interested in is how do you distinguish one from the other?
Be- uh, by looking at not so much people's descriptions of how they feel, but what they
Right.
do or what they feel like doing or how they think.
Yes.
And I think that's why, you see, one of the things that I really go back to with Ellis, and Ellis
Hmm.
says that, you know, we can't really look at emotion just by looking at emotion. We have to look at it
Yeah.
at within the kind of interdependence of thinking, behavior, and
Yeah.
feeling. And so if you take that stance, and so, if you say to somebody, for example, I was angry, they say, well, I was angry, and you say, no, is that healthy or unhealthy? And you're saying, well, what did you do? And they say, I didn't do anything, right? And then you think, oh, well, that sounds, like healthy. And then you ask the question, what did you feel like doing that you stopped yourself doing? And they said,
Uh-huh.
I felt like tearing the guy's head off of his head and stamping off his head. Well, that
Yeah.
sounds pretty unhealthy anger to me. So
Yeah.
I don't think you can. Well, I'm pretty sure you can't just make a distinction just on people's description of how they feel. You have to
Right.
look at how they think and behave, what they feel like doing,
Yes.
because we're sort of like, social animals. We kind
Uh-huh.
of are able to, to keep our
Yeah.
emotions in check. But if we gave rein to them and,
Yeah.
yeah, that's, I think,
It's
a
terrifying.
good way of doing it. Yeah.
Well, maybe another way of saying the same thing is that I think the folk psychology, like the default assumption that many people have, is that the difference between healthy and unhealthy anger would be the kind of level of intensity of the emotion. Like, and that doesn't make much sense because even a kind of low intensity simmering emotion might lead to quite a lot of unhealthy passive aggressive behavior. So, like you say, there has to be a difference more in terms of our thinking and our behavior
Well,
that
how
differentiate.
yeah,
It's a
yeah.
qualitative difference rather than a
Yeah, and
quantitative difference, right?
I think I go back to, there's some dispute whether he actually said it or not. Voltaire's famous phrase, sir, I detest what you do, but I'll defend to the death your right to do it. So, I mean, could you imagine, for example, Martin Luther King saying to him, look, yeah, just, don't be so angry about it, he had and Gandhi, I think had a healthy anger, and Martin Luther King, because
Hmm.
they were right. They saw an injustice that they really wanted to to do, but they were able to temper it with
Hmm.
planning. And
Hmm.
I think that in a way, um, I talk. I don't know if you remember in my introduction to my anger book, I talked about a situation whereby I was tearing down, the road in a car, trying to get somebody
Yes,
who,
I remember.
you know, that's not healthy.
Oh, I'll tell you why I remember because you said it was in Scotland.
Yes, it was in Scotland. Yeah.
Yeah, I was reading this book and I think he's really angry maybe with a Scottish guy. This is exact.
I don't know whether the guy was Scottish because I
Don't know
never
for
caught
sure.
it.
Yeah, you didn't catch him. Okay, well, let me play, I suppose, a little bit of devil's advocate for a minute. If if you take unhealthy anger and you swap out the rigid must statement for a flexible preference,
Yeah.
and you take away the awfulizing and you replace that with a more flexible, moderate attitude that says, okay, this is bad, but it's not the end of the world. And you take out the I can't stand it itis and the vilification or the devaluation in absolute
Of the person.
terms of the other
Yeah.
person. So let's say you change all of those cognitions, right? And the
Yeah.
action tendencies
Yeah.
are no
Yeah.
longer overtly aggressive. Is
Yeah.
it possible that you might have defined the anger? Is that still anger?
Yeah. Because because
What
because you
makes it
still
anger?
because you've still got the you you, you can't take out those things without having something in place, so what's in
Yeah.
place is flexible attitudes, non-awfulizing attitudes, what I call attitudes of bearability, not unbearability, and
Uh-huh.
accepting the person but really disliking what the person's done. So you've got, if
Yeah.
you put all those in, you've still got anger, but I would argue that's healthy anger.
I just wonder if you're thinking, what you did really sucks, but it's not the end of the world. And, I'd really prefer it if you didn't, but that doesn't have to be the case. Then it seems to me, I can imagine I don't know if I call it anger anymore. Like,
Well,
even
it
if your
depends
blood pressure
upon
was
what the
high,
adversity is. It depends upon, how
maybe
important
it
the
depends.
adversity. If again, if you look at some of the examples of people who feel strongly angry but in a healthy way, Martin Luther
Hmm.
King.
Right.
You're not gonna kind of. You see, I think in your description, you've got almost in there that you're kind of minimizing the level of the adversity.
Right.
I think you keep the adversity in there as something
Uh-huh.
really, really kind of
Really bad.
negative. Yeah.
Uh-huh.
And yeah, I mean, look, I mean, the point is that it's a bit like the black belt you talk about, Quran, the black belt of handling, um, an anger-related adversity in that way.
Mhm.
I mean, I'm I'm pretty sure I couldn't do it yet. I mean, far I'm far more advanced than that when I was hurling down the road in Scotland all those years ago. But I mean, I noticed that, and I don't know to what extent you go along with that. I mean, I find it difficult to get depressed,
Mhm.
anxiety, but I find it very easy to get angry. Is that I don't
Mhm.
know what it is. It's that kind of that tendency in me, which my father had, and his brother had, and my grandfather on my
Yeah.
father's side. That's almost like quick. That quick, and so some people
Yeah.
are quite a quick to anger, and you have to really, I have to kind of, think about. Well, I'm going into the situation. This is my vulnerability point. I need to prepare myself
Yes.
for it.
Yeah. Yeah. Well, I thought a good place to conclude, if you could, I'm sure you have an answer for this, but what's a simple takeaway, as it were? What do you think is a simple piece of advice that you could give to listeners if they are having problems with their anger? Like, there are many things that REBT might recommend to them, but what's something that you think you could explain to them in a few minutes?
Okay, acknowledge it, take responsibility for it, don't hate
Yeah.
yourself for it, and then really, if you're going to do one thing, ask yourself the question, as Ellis said, what am I demanding? What am I
Yeah.
insisting has to be or mustn't be? And then really see if you can, develop some flexible mindset in case, which really means saying, look, I really don't like this, but sadly and regretfully, it doesn't have to be the way I want it to be, because this is not the planet Dryden or Robertson, it's the planet Earth. And I often, kind of use that.
Yeah.
If it's the planet Dryden and Robertson, we could organize it so that we don't get adversities, but on the planet Earth, we can't.
We have to deal with adversities. And I think what you're also describing at some level is just simply taking more ownership for their anger.
Ownership, I think, is so important with anger.
Uh-huh. But how do you take ownership is partly by recognizing the underlying
Yeah,
demands
yeah,
that are
exactly. Exactly.
making
Yeah,
you feel angry.
that's right.
Well, Thank you very much, Wendy. It's been a joy speaking to you. It's actually a bit of a treat for me because I'm a bit of a nerd about psychotherapy, um, as Ellis was, and I think as you are perhaps to some extent. So it's
And
great
I
to have a
wanted to
chat.
ask you, Donald, it sounds like
Uh-huh.
you're thinking of writing a book on anger yourself. Is that correct?
I was thinking about writing a book about anger because I want to look at what the Stoics say and kind of compare it to what modern research says
I
and what's
would
kind of
definitely encourage you to do that.
yeah, I wanted to do it. If it was the last book I ever wrote, I thought to myself, what would I want to write about? And I thought, well, I'd like to write about anger because I feel do you know, I think many people in life reach a point where they think, you know what I'd find really fulfilling would be to help feel like I'm helping people who had the problems that I had when I was a young guy. And I thought, I always remember when I was a young guy, I was really angry. And if I felt I was helping people that were like young Donald, that would be particularly gratifying to me. So I've always wanted to get round to
I think,
tackling this
yeah, and
problem.
I think that's right, and that's you know, what a lot of people kind of do, isn't it? That they kind of that's the wounded healer in you. You want to kind of,
Yeah,
not
the
only
wounded healer.
heal yourself, but heal others in terms of, what you've experienced. So
Yeah.
go. I look forward to seeing it, Donald.
Well, hopefully we get a chance to chat a bit more about it. Maybe we'll
Right,
talk a bit more about stoicism at some point.
right.
Anyway, it's been another great discussion. Thank you so much for joining me, Wendy. I know you're a busy guy.
My
Um,
pleasure.
We hope that you listeners enjoyed the conversation as much as we did. Please share the link with your friends and subscribe to the Stoicism Philosophy as a Way of Life newsletter and Substack for more podcasts and articles on philosophy and psychology. So thanks for listening. It's goodbye from me, Donald Robertson, and from my guest, Windy Dryden.
It's been a joy.
Thanks. Bye, everyone.
Uh,